everyone, and welcome back. I hope everyone had a very enjoyable weekend. Over the last week, our region has seen a growing resurgence of COVID virus with an increase of COVID-19 cases and hospitalizations. This resurgence comes after we have worked so hard to slow the spread of the virus. The increase in cases, hospitalizations, and percentages of positive testing is very concerning to many of you out there, and let me tell you, it is very concerning to us also. That's why today we're going to be announcing new measures to regain control of the situation. These directives will take effect tomorrow at midnight and will be placed in our public health order. These measures are being announced today to give everyone time to adjust before the big 4th of July weekend. We know July 4th is a great American holiday, one that all of us look forward to and one that we all love to celebrate. But this year, we simply cannot celebrate July 4th as we've done in the past. Many of you like to have families and friends over for backyard barbecues and celebrations. But this is a recipe for disaster this year. Here in San Diego and across the nation, there are numerous reports of gatherings at people's homes and backyards resulting in COVID-19 outbreaks. No barbecue is worth that. Please limit July 4th celebrations to only members of your household. And if you're 65 or older, you need to be extra careful. Please continue to shelter in place and avoid gatherings. As we look down the road a little, we expect to be engaged in this fight against the virus all summer long. So in addition to the measures we're announcing today, we'll be pausing any further reopenings until after August 1st. At that time, we will reevaluate the situation. I know you want to hear more about the new measures, so let me introduce Supervisor Nathan Fletcher, who is joining us virtually to go on into more detail. Supervisor.
Thank you, Chairman Cox, and thank you to everyone. You know, from the beginning of our coronavirus response, the aim was to flatten the curve in an effort to preserve the integrity of our healthcare system. There was a very real concern at the outset that we could overwhelm our healthcare system because we had seen that happen in multiple other places. Our initial stay-at-home orders did that. We were successful in flattening the curve, but it also bought us time to build up our supply of personal protective equipment, our ventilators, to increase our testing capacity, our contact tracers, and to prepare for a point where we could reopen. At the outset of reopening, we acknowledged that with increased presence and increased operations with businesses and the opportunity for leisure activities, there would be increased spread. And we didn't think that we could stop all spread, but what we wanted to avoid was significant spread. And that's why we put in place the triggers that we outlined some time back. The triggers are early warning indicators that we are seeing increased or significant spread. As you are all aware, we have now hit triggers related to outbreaks. We've seen significant increases in the number of cases. We've seen jumps in the percentage of positives, and we've seen increases in our hospitalizations. The reality is this forces us to take action now in dialing back some of the things that we had reopened. Even with the actions that we are taking today and the actions that are likely to come throughout the course of this week, we expect that we will see continued increases in cases. And I think it is important to understand that there is a significant delay between when community spread happens and when it is reflected in the numbers that we see. And to those out there who will say that we are overreacting, I would just point to them the reality that the indicators and numbers we have are significantly behind what has happened. If you have community spread and transmission and you come in contact with someone who's positive, you will not likely know that you may have been exposed for the incubation period of 5 to 7 days, and then you might begin to see mild symptoms. Then you decide to get tested, and perhaps it takes a few days to get tested, and then it takes a few more days to get results. We could now be several weeks out from that initial exposure before that individual even knows they're positive. Then we begin the contact tracing process with close contact with that individual. And so there are significant delays, which is why it is imperative that you have to take action early. At the outset of our coronavirus response, we took significant action early, and we were a model for the region. And so now we're in a position where we have to begin to take action now in an effort and hope that we can slow the spread. Again, we can't stop it, but we want to slow it. And we want to, most importantly, slow it to a point where we can avoid full lockdowns or going back to where we were in March. While that is certainly a possibility, that would be the worst case outcome for our region. It's better if we can take incremental steps to dial things back, increase public awareness, and slow the spread to a manageable level that allows us to preserve the integrity of our healthcare system. And so starting this week, as Supervisor Cox mentioned, going into effect midnight tomorrow, we will be closing all bars, wineries, and breweries in San Diego County that do not have a license to serve food. Over the weekend, the state of California took a similar action for a number of counties, including pretty much all of our neighboring counties to us. And the reason that the state of California took this step for counties, not San Diego, but for other counties, is because bars are purely social settings where different people and groups often mix. It's a simple reality that alcohol consumption impairs judgment and may lead to less compliance with physical distancing guidelines. People often spend more time in a bar than other establishments like a restaurant for eating. Loud bars and loud settings require loud conversations and yelling, which spreads droplet more efficiently and effectively than you would see in other settings. And then people who do not know each other often congregate in bars, making it difficult to engage in thorough contact tracing about who may have been exposed. While San Diego County was not included in the actions taken by the state, we believe it is appropriate and we believe it is wise for us to take this action now, given the increases we've seen in cases, in percentage of positive cases, in outbreaks, and the increase in hospitalization. We don't want to be wait to be forced to take an action when we know that it is the wise and responsible thing for us to do now. So beginning Wednesday morning, July 1st, the following changes will go into effect. First, bars, breweries, and wineries that do not serve food must close. Second, we are reinstating the order that beer, wine, and alcohol can only be consumed at an establishment while you are simultaneously eating a meal. This means you can't go to a restaurant that serves beer, alcohol, or wine and just sit at a table and drink. Any drinks you consume must be a part of your meal. Enjoy your meal, have a few drinks while you enjoy your meal, and then when you're done, exit the establishment and go on your way. Third, if you do go to a bar, brewery, or winery that does serve food, there is no standing. This is consistent with our public health order, but we want to reemphasize it so that all of the restaurants out there that serve both food and alcohol know that it is only allowable to consume food and alcohol when seated at a table. This is a part of the order, but we want to reemphasize it. In addition to this action, we fully expect in the coming days we will be instituting additional changes to our public health order and additional dialing back and guidance that are a part of our effort to slow the spread of COVID-19. As was previously mentioned, we will not be considering any new reopenings on new guidance that comes from the state of California, at least for the duration of July. 3, we'll be speaking to hospital CEOs today and looking at what they might need and what steps they might wish to see taken, both as it relates to our hospital system and healthcare system, but also the broader community. 4, we will be working on efforts to increase enforcement, both what we can do internally through our public health agencies and with working with law enforcement. And 5, we really want to focus around July 4th weekend. This is obviously a large holiday. It is common for folks to gather, and we are strongly encouraging San Diegans to please be responsible and avoid gatherings, avoid indoor gatherings. We're reminded that there are no mass gatherings allowed at private homes and residences. We have seen a number of outbreaks tied to individuals having parties at their home, and that is not only against the public health order, but it will set us back as a region. The most patriotic thing we can do on the July 4th weekend is adhere to the public health orders and work to save lives. And that is what we are hopeful that we will do. And that last point really gets to the essence of what we're saying, is that we cannot do this alone. No public health order and no increase in enforcement alone will slow and stop the spread. We really need each and every San Diegan to buy into why this is important. It's important to preserve life. It's important to preserve our ability to continue reopening. And so we continue to ask everyone to please utilize a face covering anytime you're within 6 feet of a non-household member. Please avoid large indoor crowds, and please take seriously the work of our contact tracers. Last Thursday, I was notified that I had close contact with an individual who had tested positive for COVID-19. While I have no symptoms and feel great and have tested negative, I am following the public health guidance around quarantine. 14-day quarantine for those who have been in close contact with a positive. This is a cornerstone and hallmark of effective public health, but it is also essential to our ability to slow the spread moving forward. And so we ask the public, if you receive a phone call from a contact tracer, please engage with them. Please be honest with them. Please be candid with them. If you get a call that says you've been exposed to someone who's a positive, please adhere to the 14-day quarantine. We're going to have to all get used to the new normal, where we may have friends or family members, coworkers or employees who have to go into a quarantine. It doesn't mean you can't work. On Friday, I participated in a California Resources Board meeting, a workforce partnership meeting, numerous meetings around coronavirus. Here today, I'm joining our press conference. We've been in meetings all day surrounding the actions we're taking now. But it is important that we all do our part to slow the spread. And so we are asking for the public's help and cooperation. We don't want to dial things back. We definitely do not want to go back to a full shutdown, but we have to manage and contain the spread here. And so we're asking for the public's continued help. With that, let's jump into our charts for today. We will begin with the first chart, which is our T3 chart around testing, tracing, and treatment. So what you'll see here today is continued significant progress around testing, and I want to commend everyone in our public health department, Health and Human Services, for the increases we've seen. Today we're reporting 6,908 tests. Our rolling 7-day average is 7,782. We are well beyond our initial goal of 5,200 tests per day. We have worked to expand testing. The Tubman Chavez Center is available for non-appointment testing. You can show up and wait in line and get tested. We are seeing an increase in demand for testing as we see an increase in cases. And we encourage folks to go to 211sandiego.org and find a testing location, schedule an appointment. Or if you don't want to do an appointment, you can go to the Tubman Chavez Center, which is an option. But again, contact tracing, you'll see 476 who are out there now, more than 16,000 case investigations performed. I've experienced one of those. And again, I want to commend our contact tracers for what they do every day to help us in the fight of coronavirus. Our next chart, you will see that today we are setting a new record in number of positives, 498. That's beating yesterday's record. Yesterday was the previous record. Prior to that, it was 2 days before that. So again, 498 new positive cases out of the 6,908, which is a 7% positive rate. Again, our rolling 14-day average is 4.1%, and you can see in the purple line there the significant uptick we've seen in percentage of positive cases as we move through. This is very concerning and part of why we're taking today's action. Our next chart, number 3, you will see here is hospital census in San Diego County for COVID patients. You see an increase in both ICU-related COVID patients from 165 to 178, and an increase in total COVID patients from 427 to 458. So again, both of these are increasing, and you can see over the course of the last week the steady increase that we've seen in COVID-related hospitalizations. The next chart will show you the COVID hospitalizations at the bottom and the total hospitalizations. And what you can see here is as we've seen an increase in COVID-related hospitalizations, we've seen non-COVID hospitalizations decrease just a little bit over the preceding days, which puts us just below that 4,000 number of total hospitalizations in our county. And then my last chart is our ICU capacity. And again, what you can see here is the 178 is the COVID-related ICUs, which is an increase from yesterday and an increase going back several weeks for COVID, but a slight decrease in non-COVID ICU utilization. And so we're holding relatively flat, down a little bit yesterday to today in terms of overall ICU capacity and utilization. That concludes my section of the report. I'll now turn it over to Dr. Wooten for her public health officer's update.
for your virtual update and welcome everyone to today's briefing. Global, national, and state statistics are based on our data that is retrieved from the Johns Hopkins dashboard. And globally, there are almost 10.2 million positive cases, including almost 503,000 deaths. Nationwide, the United States is reporting almost 2.6 million positive cases, now at 25% of the global number, and includes almost 126,000 deaths. In the state of California, there are almost 216,000 positive cases, which is 2% of the global number, and includes almost 6,000 deaths at 5,935. Today, the County of San Diego is reporting 13,832 cases, which is 498 more cases than yesterday, and the largest number of cases in any one day reported to date. This includes 361 deaths. There were no new deaths reported since yesterday. The age range of cases is unchanged from 3 months to 102 years of age. 55% of the total number of cases are between the ages of 20 and 49 years of age. And of note is that from the very start of the pandemic, individuals in this age group have represented the majority of cases. Breaking down this age group further, the 29 or 20 to 29 year of age, if you can go to the next slide. Yes. Represents 22% of all cases. 30 to 39 is 19% of all cases, and 40 to 49 is 15% of all cases. And as you can see from this graphic, it really tells the story that from the beginning of the pandemic, those in this age group, 20 to 49 years of age, represented the largest number overall. But if you dissect this age group further, you can look that the largest number of cases is in the 20 to 29 10-year age group. And you can see that for 10 to 19, there's been an increase every month from March, or rather April, through June. The same is for the 20 to 29. For 30 to 39, consistently about the same number, and then you can see the decrease in the number of cases by percentage here for 40 to 49 years of age. In contrast, in the next slide, we show individuals 50 years of age and older. And this shows a persistent decrease from 50 to 59, 60 to 69, 70 to 79, and 80 plus. So what does this mean? People are going out in larger numbers and interacting with people outside of their households, particularly in the 20 to 29 age group. Also, in terms of demographics for the total number of cases, again, females represent 51% of the total number of cases, males 49%, and 1,754 or 13% of cases have been hospitalized. 481 of the total number of cases have been admitted to the ICU, and this number is 4% of the total number of cases and 27% of the total number of those hospitalized. And as of June 28th, yesterday, the county has surge capacity for hospitalizations at 35% and for ICU admissions at 35%, which is where we actually want to be. Supervisor Fletcher noted that for COVID-19 hospitalizations, the number were overall at a record high, but the overall number of hospitalizations is maintained at 65%. Now, let's turn to deaths. The total number of deaths from the total number of cases is 361, and this represents 3% of our total cases. Of the total number of deaths, 42% were female, 58% were male. 341 or 94% of the total death cases had underlying medical conditions. And the county, as always, extends its sincerest sympathies and condolences for all of the individuals that have lost their lives due to COVID-19 during this pandemic. In the following slides, we want to show data in a way that shows what our progress has been in the prior weeks, located on the left, and then for the most recent 14 days or more, reported on the right. And this is for tests. You can see that we've had consistently good turnout for testing in the last 14 days. Next slide. And in the slide related to new cases, as reported before, the number reported today is the highest. It's one more than yesterday, so we have had a consistently increase in the total number of daily cases for the past 4 days. Next slide. And for hospitalizations, while the daily number of hospitalizations for the 28th was 7, we see that over the past week, the number of hospitalizations have increased over time. And so we will continue to monitor this because actually this is one of our metrics, has been abnormal for the past 4 days, but today has normalized. Next slide. This slide shows residents in terms of new ICU patients, and as stated before, while we've had increased number of overall hospitalizations for COVID, the ICU number for yesterday was 2. Next slide. And then for deaths, again, when you have the cases, hospitalizations, ICU, and deaths lag in that order. And you'll see here, typically over the weekend, we have no report of deaths due to the fact that we have to do reconciliation with our Vital Records Department. So we anticipate that we'll have a higher number of deaths tomorrow and Wednesday and later in the week. Next slide. And this is our epi curve. And you can see under the epi curve the numbers of cases, the number of cases by onset of illness are significantly higher. And this is in the last 14 days, which means we know we will have more tests. And in the face of the fact that there is already a high number of cases, this just basically supports the fact that COVID-19 is out there in our community, it's pervasive, and we need to continue testing efforts to identify individuals that are infected so that they can be removed from the general population and placed in isolation, and also have their close contacts identified so they can be quarantined. And in the next slide, so now we are going to talk about, actually, just go back one slide, please, to the seal. Thank you. So now I want to talk about outbreaks in general and community outbreaks in specific. Since the beginning of the outbreak, we have had 134 outbreaks in congregate settings as well as community settings. And to provide the context here, of the 134, 69 or 51% are now closed and inactive, meaning no cases reported in the past 14 days or longer. Of the 134 outbreaks, 65 or 49% are still active. And of these 65 active outbreaks, there are 3 categories. The first is skilled nursing facilities. We have 21 or 32% of the 65 outbreaks in skilled nursing facilities. We've had 1 new outbreak reported since yesterday. The next category or group is non-skilled nursing facility congregate settings, and we have 22 or 34% in this group. We've had no new outbreaks since yesterday. And then lastly, community setting locations, we have 22 or 34% of outbreaks that have occurred in this setting. And we have 2 new outbreaks that were reported since yesterday, and these specifically were in restaurants and or bars. Now, I want to now transition to our triggers. This is a nice segue into talking about our triggers. On this slide, the trigger that is abnormal is community outbreaks, and as you saw before, we have 7. The target, and the description here is 7 or more community setting outbreaks in the past 7 days. And this is, as stated here, trigger number 2. This slide shows the outbreaks, again, reported over the past 7 days, and it shows the type of, the next slide shows the type of settings. Should be the next slide. There you go. So these are the locations from private residences, businesses, restaurant, bars, and as well as just restaurants. And it shows the date the outbreak was initiated, and then the date the outbreak was confirmed. And actually, restaurants and/or restaurant bars represent 27% of all of the active community setting outbreaks. Now, over the past few weeks, we have seen a marked increase in people interacting and gathering in large numbers with individuals outside of their households. And that's why we are seeing the increased number of cases as various businesses open up. We recognize that many people are losing fear of the virus, and we are getting numerous reports of people not wearing facial coverings and gathering with others. The simple matter of the fact is that the pandemic is not over. The virus is still pervasive in our communities, and it is still widespread, with the numbers increasing every day. Again, today's report is the highest number of cases to date. Whatever age group you fall in, it is vital that everyone remembers that our actions have power and can save lives. We are asking individuals to wear facial coverings, maintain social distancing, wash your hands, and please do not convene dinners or house parties, and conduct no gatherings of any kind. We all have a role to play, and the measures that we set in motion will help to prevent the spread of COVID-19, to protect others and to protect ourselves. So as previously stated, we will not be opening up any new businesses for the duration of July. And as Supervisors Fletcher and Chairman Cox have indicated, we will take action to close bars, wineries, and breweries that do not serve food beginning Wednesday morning. Now more than ever, it is vital that we all take precaution to guide our personal as well as our collective health. So now please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. Let's go directly to the questions.
Matt Hoffman with KPBS, please state your question.
Hi, appreciate the time. I know Supervisor Fletcher discussed why bars are problematic, but in your guys' contact tracing, have you been able to find any outbreaks or hot spots at any county bars, breweries, or wineries, aside from the kitchen staff and the restaurant staff?
Dr. Wooten's going to respond.
If staff could go back to the slide that shows the 7 outbreaks that are, if you can go back to that slide. I think that slide shows that we have outbreaks in restaurants as well as restaurants and bars. There you go. Does that answer your question? And
yeah, so you guys have been able to trace outbreaks back to bars and like breweries?
I'm sorry?
Have you guys been able to trace back outbreaks to bars and breweries?
So this slide supports that question. It answers your question. The answer is yes.
Okay, and then just a follow-up question regarding enforcement. I know you guys have said a few times, including today, that it would be stepped up, and the governor also wants to see that, and he says he's including $2 billion in his budget to see that enforcement on a county level. What does that look like for you guys? Is that sending out like code compliance officers, or what does that look like from you guys?
So we will be working with law enforcement across all of our city jurisdictions, as well as our county sheriff's department, to examine and define a concrete plan. But really and truly, adherence and enforcing the regulations that are already in place will help to bring our numbers down and support the actions that we are taking.
Thank you.
Okay, next question.
Sasha Fu with KUSI, did you have a question?
Yeah, it was kind of a follow-up to Mr. Hoffman's question there with the stepped-up enforcement. You see uniformed officers getting involved in this? And then I have a second question.
Okay, Dr. Wooten.
Sasha, in my last response, absolutely, we will be engaging and engaging law enforcement across all of the city jurisdictions, as well as our sheriff's department with the County of San Diego to step up enforcement and to support the actions that we are proposing today and will implement throughout the rest of the month of June as well as July. And you had a second question?
Yeah, this is a question from Mike McKinnon. What do you say to people who say if you close the bars, you need to stop the large gatherings of protesters as well?
Well, people that protest is a constitutional right. We just ask that if they do protest to wear their facial coverings and adhere to social distancing.
They should get tested for COVID, should they? If you're participating in a protest, are you recommending that they get tested?
You know, we have not seen any outbreaks associated with the protests to date, but we are recommending that individuals, if they feel they should get tested, they should be tested, and particularly if they've been associated with individuals that have tested positive for COVID-19, we certainly do recommend that they are tested.
Okay, thank you.
Okay, next question.
Will Huntsberry with Voice of San Diego, please state your question.
Hi there. So you guys gave us these great 13 triggers to follow several weeks ago, and you know, I duly wrote about them like the diligent reporter I am. And then, you know, more than a week ago, we started seeing these triggers go off and no action be taken. You know, the big trigger went off of community outbreaks. So I guess my question is, with the percentage of positives rising and all these triggers blinking on and off, do you think you've waited too late to try to slow the spread, and are you not doing enough?
Okay, Dr. Wooten.
Well, happy to answer that question. First of all, there have only been 2 triggers that have been abnormal, and one particularly is community outbreaks. And as I stated at the very onset of sharing these triggers with the public, is that we would not be closing down at the time any industry in general. We would focus on the industry that has or is impacted, and particularly restaurants is a great example of that. And even during our Board of Supervisors meeting, we shared what we would do with restaurants. And so to say that we have not taken any action is highly incorrect, because we work very closely with the Department of Environmental Health when there is an outbreak at a restaurant. And there are several measures that are taken to ensure, number one, that the restaurant operates under the best guidance and guidelines, public health best practice guidelines. We have to have them redo their reopening plan. They conduct sanitation, and in many cases, they close down to conduct all of these measures before they open back up. So to say that we have done nothing is a huge misjustice, I feel, and an incorrect statement. So that has been the area where we have had, that has been abnormal, and we have worked with the various entities that have the outbreaks. And as you are seeing here today, as a result of the number of cases increasing, and as a result of the continuation of outbreaks and our counties around us having issues, we have taken the action to close down bars, breweries, as well as wineries, so that we can begin to try to curtail the COVID-19 spread, because these are the areas where most of our younger population is going, and that's where we are seeing our highest number of cases. Thank you.
I appreciate that answer, Dr. Wooten. And I was just asking if the action was too late, not if you hadn't done anything, with us seeing this percent of positive cases also really steadily increasing. I guess I'm wondering, is part of the challenge here that, everything that's happening, like in these times, quote, I mean, there's just so much going on in society. We're dealing with economic collapse. We're dealing with COVID. We're dealing with racial justice protests. I mean, is there just like a challenge in garnering the willpower to start shutting down society again?
So our intent is not to shut down society, but our intent is to curb the spread of COVID-19. So the actions we've shared with you today is a step in that direction. So we feel comfortable with those actions, and we'll continue to implement these actions throughout the next 5 weeks through the end of July. Obviously, it's a challenge. The entire world is going through this challenge. This is nothing unique to San Diego County. We think that we have done quite well, however, in the response to COVID-19. But again, as we open back up, we knew that we would have an increased number in cases, and we just have to, as we commonly say, own it and manage it so that we can prevent the spread of this disease further. Thank you.
Thanks.
Okay, let's go to the next question.
Paul Sisson with the Union Tribune, please state your question.
Thank you. How many people who tested positive in San Diego County visited bars, wineries, and breweries? How many? How many cases have you actually gotten out of these locations?
I'll let Dr. Wooten respond to that, but it's probably, actually, Dr. McDonald's going to respond.
Sure. We don't have an exact number. Again, remember that the information that we get from interviews is what people tell us. We certainly ask questions about a lot of these types of exposures, but we don't have an exact number. Again, people don't always give us complete histories about what they have done during the 14 days that they could have been exposed to the virus, but we don't have an exact number for you at this time. We do have the information that was provided about outbreaks, and we are trying to build our systems to be able to answer in an electronic fashion those types of questions. Right now, though, it's a little bit labor intensive to try to answer a specific question like that, but we will get back to you with as complete information as we can, Paul.
Yeah, another regular email that I'm getting is people wondering how many of these cases that have tested positive in San Diego have a primary residence listed in Arizona. Can you tell me what percentage or how many of our positive cases live in Arizona and are visiting here?
That's a great question. We actually do track non-resident cases as a separate number, and we will get that total number to you by the end of today. Again, I check on that every few days, don't have the number off the top of my head. We have looked specifically at nearby county residences. Certainly the number of individuals who live in Imperial County who are diagnosed in San Diego have increased in the last number of weeks, and the number of cases who have Arizona as their primary residence have also increased in the last number of days, and we can get those numbers to you by the end of today.
And another final question has to do with elective surgeries in our local hospitals. As you recall, hospitals were allowed to resume elective surgeries as long as they had a plan to ramp back down if the volume started to increase of COVID patients. Now that's exactly what we're seeing. How far are we from the county asking hospitals to stop bringing in new elective cases?
Well, as the supervisor mentioned, Supervisor Fletcher mentioned, one of the actions that we're taking is to be discussing this very topic and other issues with our local hospital CEOs to determine what we can do to best manage the potential workload into the future for both hospitalizations and intensive care units. So that's on our docket, and you may learn more later this week.
Thank you.
Okay, let's go to the next question.
Hello, Derek Stahl with 10 News. Do you have a question?
I sure do. Thank you so much. And just on the note of the previous question, I'm sure our station and others would be very interested in the number of non-resident cases and Arizona cases. So if you guys could send that out to all media outlets, we would be very appreciative. But my question is either for Dr. McDonald or for Dr. Wooten, has to do with contact tracing and response rate. So last week there was a report that New York City's contact tracing program was running into a lot of problems because they were getting a very low response rate. And they basically found that in the first few weeks, only 35% of people who tested positive actually gave information about their close contacts to the tracers. And so I know we're tracking the number of investigations, total investigations performed. It's like 16,000. But are we tracking response rate? And are the contact tracers here in San Diego County running into any issues along these lines with people not providing information about close contacts?
Okay, Dr. McDonald is going to respond.
So the first question was about comment was about the information about non-resident cases, and we'll absolutely share that with anybody who desires it. And so I want to make sure that's clear. And we don't specifically follow that metric, that is to say the number of people who aren't giving us any close contact information. I think actually it's a sort of a nuanced question. We often will get great information about household contacts, and those are the most important contacts that an individual has. It gets a little more difficult, and it's difficult to track as a metric, frankly, the other close contacts that individuals might give. I would say that the general gestalt from talking to our contact tracers is that most individuals are actually quite cooperative and do give as best information as they can about close contacts, and we really appreciate that. And indeed, one of the reasons why we are so careful about not detailing in huge degrees where we have had some of our cases is precisely for the reason that we want to protect that information. If people give us information confidentially, we want to be able to act on it on an individual basis in the same way. So we think we are probably doing better than the numbers that you heard from New York. It's difficult, though, for us to drill down on that specifically, but we will try to see if we can do that in a more precise way. Again, we are constantly looking at our databases and trying to automatize it so we can get questions that are very specific, drill down, both for our purposes epidemiologically, but also for your information to communicate to the public and to the media.
Appreciate that answer. Do you have any anecdotal estimates on just the number of people who are entirely unreachable and you can get no information from whatsoever?
That metric, I think, is on the T3 or on one of our slides. I don't remember off the top of my head, but let me try to get back to you on that. Yes, show the trigger slide. I knew it was on one of our charts, but I couldn't remember which one it was. If you could pull up the trigger slide, I'm pretty sure that contact tracing, that 87% means that we are able to contact those individuals within 24 hours. So that gives a good indicator, I think, of where we are. That's certainly above what we set as our own threshold, and that was actually based on some of the other contact tracing in other jurisdictions and our own ability to contact trace with other diseases. So I think we're doing pretty well from the contact tracing perspective.
Thank you.
Yeah.
Okay, we have one final call-in question.
Yes, Vanessa Van Hefty with 10 News. Please state your question.
Hi, I had a question for Supervisor Fletcher. The question is, you have been at odds with some of the board members regarding the votes and just your position on the reopening. Can you tell me if you're more in agreement with that at this point today?
Well, I've always been on the more cautious side throughout the duration of this, certainly than a few of my colleagues, in terms of a desire to move slower. I think there's generally been a disconnect in general with large sections of society between the actions we took and the outcomes we saw. So we did not see significant early spread because we did incredibly unprecedented things to delay it. And as we began to reopen, I think that there was a disconnect there. Having said all of that, my hope is that we can manage our way through this and contain the spread in a way that preserves the integrity of our healthcare system that doesn't require us to go back into a full-scale lockdown. And so, I've been more cautious. I wanted to move a little bit slower. I probably err more on the side of moving or a desire to move more swiftly to respond to triggers or increases. But I think as a county, we all have to recognize and realize what's happening. And the spread that's increasing, the percentage of positive that's increasing, the hospitalizations that are increasing, even though it is younger folks that are showing more positives now, that's a concern, one, because it's not good for them, but two, they have the potential to spread it to the vulnerable. And so, I think in all of this, my hope is through all of this, whether you are more cautious on reopening or more aggressive on dialing back sooner like I was, or on the other side, that we can all agree that this is a real problem and we all need to take action to get these numbers under control.
Okay, we'll go to our first text question, which has to do with the concern about people from outside of San Diego County coming here over the 4th of July holiday. And Dr. McDonald's going to respond to that.
So that question is, with so many counties geographically surrounding San Diego being watched due to high numbers, are local officials concerned about those people coming to San Diego during the upcoming holiday weekend and how that could impact our local cases? And that question is from Leah with Channel 10.
I think that is a great question, and if you go back to what some of the restrictions that were announced today, so that we are more consistent with our neighboring counties in terms of bar closures, it somewhat addresses that. Certainly, if all of the surrounding areas had more restrictions and we were perceived as a place where individuals could have more freedom to do certain types of social interactions, that could be a draw, but I think that one of the things we're trying to be very careful with is to approach the July 4th weekend to be consistent with our neighbors. And I wanted to say that I actually have a very fast staff, okay? They got some information back to me that actually the total number of Arizona residents who have been diagnosed in San Diego County with COVID is 16 throughout the entire length of the time that we've had COVID bedeviling us, but 7 of those were actually in the last week, so that's an important thing. And then there have been 330 Imperial County residents who were diagnosed in San Diego, and 61 of those were in the last week. So I had those numbers, they just shot them to me. The numbers about the other non-county residents will be coming and will be disseminated.
This one is actually related to Imperial County, Dr. McDonald, and there's two questions from Claudia with Univision. The first one is, would you be able to confirm if there has been a surge in ambulance calls coming from the border seeking COVID-19 related assistance at local hospitals?
We have been following that metric daily as part of our unified command for the border, which has representatives from both the county, Imperial County, the state, CDC, our Office of Emergency Services, and others. Interestingly, the number of ambulances that have been coming from the border have been relatively stable. And not increasing in the last number of days, but we follow the number that are coming and the percentage that are of concern for COVID. They are certainly increased in the last 2 months compared to the way they were a number of months ago, but it hasn't really been that different in the relative recent couple of weeks. The number of cases of COVID in Tijuana have been decreasing, so that's good news, but the number of cases in Mexicali have stayed the same. So again, we anticipate that we will continue to have some number of ambulances coming from the border, but it does appear to be stable at this time.
And then the follow-up question from Claudia is, are there any concerns over hospital capacity with cases coming in from Imperial County and the border?
Well, as you may or may not know, state is managing the evacuation of hospitalized patients from Imperial County throughout the state. It turns out that over half the individuals who have been evacuated from Imperial County have in fact come to San Diego. But that is only done in consultation with each accepting hospital, and certainly hospitals wouldn't be accepting any new patients if they thought that they wouldn't be able to handle them. We are indeed continuing to get some patients, but that is actually being distributed throughout the state, going as far up as the Bay Area.
This next question deals with beach closures over the 4th of July weekend, and Supervisor Fletcher is going to respond to that.
Yes, this question is from Priya with NBC7. Are you considering closing beaches ahead of the holiday weekend?
Thank you, Priya, for the question. We're going to reach out to the cities and assess their level of comfort in being able to enforce the physical distancing requirements of the beaches. We have to date not seen significant numbers of outbreaks or case spreads from outdoor type settings. So there is more concern about indoor versus outdoor. But it is certainly something we're going to reach out to the cities and ascertain. They're the ones who have to enforce what is happening at the beaches and get a sense from them of if there's some action they would like us to take.
Thank you, Supervisor. The next question deals with
It's a question from Alexandra Meeks with CNN about anticipated reopenings. Do you anticipate bars will be permitted to reopen August 1 alongside other businesses that will be allowed to resume operations at that time?
Okay, Dr. Wooten's going to respond.
Thank you for that question also. As has been stated throughout our management and response to COVID-19, we want to be evidence-based driven. So we will reevaluate as we are going closer to the end of July. It really depends on where our numbers are. We are making our decisions today based on the statistics and the data that we have, and we will do the same in reassessing the data. And actually, we will continue to assess all of these metrics throughout the month of July and throughout the duration of this pandemic. But we will use the data to make a decision about what the next steps are for the month of August. Thank you.
And Dr. Wooten, if you could stay there, I have a few questions from Taryn Mento with KPBS. I see from the charts that testing results include batches of prior tests. This is the case for multiple days over the last week. So her first question related to that is, how can the daily positive rates and new cases be accurate when it includes prior tests? And I'll hold the follow-up question.
Well, as is stated for trigger number one, if there's been an inconsistency in testing and it has not been stable, that particular metric cannot be reliable. We actually are looking at changing two of our metrics and to look at collection date, but that's something that we will look at over this next week and hopefully roll out next week.
And the follow-up question is, you have previously said that past glitches that caused reporting delays had been resolved. What is continuing to cause this problem?
Well, there are some batch delays that you can't predict. So when we find out about those, we let that be known. And so we can't control those factors, but we can be mindful of them, and that will help determine whether or not some of our triggers, such as trigger number one, is reliable or not. And that's why we are also looking at maybe changing that trigger.
And then the final question from Taryn is also, can you clarify again when exactly the new rules in regards to bars go into effect?
Wednesday morning,
Midnight.
this coming Wednesday morning, yes.
Well, that concludes our questions for today. One of the things that has just happened over the last weekend was that we acknowledged that our medical operations center has been in operation for 150 days. That's not necessarily something we celebrate, but we acknowledge it, and we thank Rob Sills and all of the folks over at the Medical Operations Center for the great job that they're doing. Because of the changes in circumstances and some of the new orders that are coming out, we will have a media briefing tomorrow at 2:30, and then again on Wednesday at 2:30. Until then, stay safe, San Diego, and make sure you wear your facial coverings. Thank you.